Hello, everyone. A very good morning. Welcome to this live. Dr. Seema will be joining us soon. And before I begin anything today, I just want to take a moment and wish you all a very happy Lodi, Makar Sankranti, Pongal, Uttarayan, Bihu. I don't know. There are a lot of this entire week is a festive week, and the message which it gives us is all together. It symbolizes a lot of things. Let's honor our rich traditions, spread some love, and uplift one another as we celebrate this festive season. And wishing you joy, gratitude, and a new beginning. Thank you so much. Having said that, if you have not posted your questions in the Google form, we are going to post it again. And I would request Kritika, could you please drop a message and share the link again that we are live. If anybody wants to pose their question, there are already 5 questions with us today. And I'm going to take one by one till Dr. Seema joins us. So yeah, I'm going to take that up. So first is the question, maybe I'll, once Dr. Seema will join, I'll pass this on to that. The question is, can I travel in my 25th week of pregnancy? Do I need to consult before going for a week? Okay. This thing, medical standpoint, Dr. Seema would guide better. But yeah, from our experience, if it is not very much urgent, in the last couple of weeks, we should take extra care. That is one thing. And next is, as my pregnancy is due in April, what important things should I do to get ready for that day? Okay, so it is a very beautiful question. Thank you for asking that. So from the standpoint of preparation, I think what all needs to be done for the child and mom from the, yeah, hi, Dr. Seema. So we have Dr. Seema with us.
Hi, good morning. Good morning. Happy Lodi.
Happy Lodi. I just, started with that only, that Happy Lodi, Makar Sankranti, Uttarayan, and, Bihu. It's entire a festive season. So wish you all
Yeah.
happy festive season. So yeah, Dr. Seema, I can see you're traveling. Thank you so much for still joining and making some time for this live. So I'll start with that questions only. So anything before we start you want to say, Dr. Seema?
No. I think we can start right away. No,
Okay, so
nothing
I'll
to do.
read the question. So there was a one question which we carried forward from last week. So let's take that first. So the question was,
Yeah.
how can PMS symptoms of irritation be managed effectively, both medically and emotionally? So the emotionally part I covered, in the last live. So I would like you to take this up from the medical standpoint, how that it could be taken care of.
Okay. So PMS, as we all know, is called premenstrual syndrome. So what is premenstrual syndrome? It is basically a group of symptoms which bother women, let's say around 10 days prior to their expected date of period. So the change in the mood or various physical signs which women feel as a part of premenstrual syndrome, they are because of the change in the hormones which are happening during their menstrual cycle. So basically, the day after ovulation, that means day 14 and 15, mid cycle, and 10 days before we are expecting our next period, there are few things which most of the women complain. They may complain of pain in their breast, which means soreness of the breast can be there. Then they can have bloatedness, they can have sleep disturbance, they can have mood irritability, and many a times they have craving for various foods and especially sweets, or they will feel more thirsty. So these are the basic 5 6 symptoms which are very commonly felt when one is experiencing a premenstrual syndrome. Now, these symptoms may vary from one to the other individual. Somebody have more of breast tenderness, which we call as mestalgia. Some people may feel more thirsty. Somebody can have more of the cravings for sweet and not rest of the symptoms. Somebody may just feel bloated and have swelling of the hands and feet, or even numbness of the hands because of the swelling of the, we call it carpal tunnel, in which you have edema around the nerves of your hand and you feel your hands have become numb. So these are the various changes which happen amongst women when they are expecting their period, let's say 10 days prior. Now, emotionally, you've already discussed in the last session. So, talking about the medical management, see, first and foremost, we lifestyle changes which a woman or a girl can bring in their daily life so that this problem troubles them lesser, is like less of the salt intake and less of water intake. Like if you take a lot of high salt intake foods, for example, pizza or your pickles, in which there is a lot of salt which is used for preservation and all. So, salt intake, when it is on the higher side, always causes more of water retention. And if you drink a lot of water along with salt, then your body will feel more. The carry home messages like 10 days prior to your period, you can watch your salt intake, be mindful, not take very salty things, and restrict your fluid intake to a moderate amount. Let's not drink 3 liters. You can just do away with 1.5, 2 liters of water intake every day. That is part one. Now, second thing which we commonly give is the Primosa oil capsules. So we have capsules and tablets. They come by the name of primrose or primosa. So there is a plant which is called primrose, and that plant, the oil base is the capsules. Now these capsules help very well with the premenstrual syndrome. So primosa capsules once a day, if a woman takes it.
So, Dr. Seema, your voice is breaking, and I think the camera is frozen. Please check that. So till the time Dr. Seema joins in again, the very useful thing that Dr. Seema was telling is, first was to take care of your salt intake, right? And second was to take care of the fluid intake. So Dr. Seema will continue with that now. So yes.
Yeah, I'm sorry, I got disconnected. So, so we spoke about the Primosa capsules, and then last but not the least, if PMS is bothering some girls or women quite a lot, then we do give birth control pills or a combination hormonal pills to suppress the natural ovulation and the hormonal surge in the body. As a result, the PMS gets relieved. So, any woman who's not planning to have a baby immediately and is not concerned about fertility at the moment, even birth control pills is a very good treatment option to get rid of the PMS symptoms. So, these are 3, 4 things which can be done. And plus,
So we are losing you in between, Dr. Seema. Yep. Now we can hear you.
I think it's wrong with my network. It's logging out.
Yes,
Okay.
it's quite unstable. Maybe, yeah, but we were able to, hear all
Okay.
the last things. But yes, in the
So that is, I
summers.
think, all about PMS. So we should get our thyroid checked. One must get hemoglobin checked and vitamin D. These are the 3 basic tests. Because if we are low on hemoglobin, we are anemic, we feel these symptoms even in a more severe form. If we are vitamin D deficient, PMS will bother us more. If we are thyroid dysfunction, then also PMS is exaggerated. And one very important thing, PMS is relieved by regular exercising. So one must be very, very mindful of one's lifestyle. You must do at least 20 to 30 physical 5 times a week, and there are a lot of studies show enjoy. The PMS symptoms are dramatically helped. So that's about it. I don't think I want to add anything more about PMS.
Okay, thank you so much, Dr. Seema. I think that was a very, Hello, can you hear us? Your camera is frozen, Dr. Seema. If you can hear us, just let me know. So, but yeah, that was a very insightful answer. And I think the women who are suffering with PMS got a lot of information that what they need to take care, and salt intake, water intake, Primosa, that is primrose thing, tablets. And then if we are not in that, age of, where you want to conceive, it is under the supervision of doctor. Dr. Seema talked about the other medical treatment. And another thing last was including the exercise in your routine. These 5 things will really help you medically for managing your PMS. So thank you so much, Dr. Seema, for that. And now I'm moving on to the another question. That question is, hello, ma'am, can I travel in my 25th week of pregnancy? Do I need to consult before going for a week?
See, usually, if it is an uncomplicated pregnancy, if it is not a high risk pregnancy, means we are not having a high blood pressure, high sugar, or twin pregnancy, or any reasons for which traveling is contraindicated. Otherwise, for most of the women in the second trimester, traveling is medically allowed. There is no reason why we should tell you not to travel. But I always give a piece of advice that let's avoid avoidable traveling. Okay, please go out and enjoy yourself when you really want to do it, but not for any trip, because pregnancy is not the time when you should be overzealous or you should be adventurous. But if you have to plan a trip, yes, second trimester is the safest time. So, second trimester is 14 weeks up to 28 weeks. So, during that time, you can travel, not a problem.
Yes, I think, and yeah, there was another thing, consult before going for a week. That definitely they can, consult with the gynae, because they might be better
Yes.
knowing, they might be knowing what is your, case history or anything, as Dr. Seema mentioned. If there is not any
Yeah.
complication and it's a very easygoing pregnancy without any complication, the doctor would be better person to guide you on that. And another question, Dr. Seema, we are having is, as my pregnancy is due in April, what important things should I do to get ready for that day?
Japinder, my personal advice would be for every patient, the advice is customized, it is individualized, because I don't know who's asking the question, what is the medical history behind it, whether she's a priming or a second time mother, or she's overweight, or she's hypertensive. So, but to cut it short, I would say that we have some videos which we have recorded for general do's and don'ts. It is a pregnancy guide which is on Sehatnama with Rajinder channel, and if one logs on to that, you can get month by month tips, 5-6 minute videos of general do's and don'ts. To give few tips, I can tell that, like, if delivery is due in April, that means the person is in the third trimester. So basic things which have to be looked for is one, adequate diet, adequate rest, optimum weight gain, which should be 2 kgs per month, and regular exercises, prenatal exercises, so that we prepare our body as well as mind for a vaginal delivery or a normal birth. Otherwise, if we do not do regular exercising and our body and mind are not prepared, then in the last moment you start asking for cesarean or a major surgery, which is not the right thing to do. So one must go for the regular checkups, the prenatal supplements, your exercises, take good amount of diet and rest. That is the basic thing which is universally holds true for all pregnant women in their third trimester. And they should watch for baby movements. Like, you must count at least 10 to 12 movements per day. Though babies, they move 40 to 50 times, but we expect you to count 10 to 12 movements in a day. Because if baby movements are less, that is a red flag and you should report to the hospital. So these are the few basic things which every pregnant mother in third trimester should look after.
Yes, that question is from Dr. Garima, and she's second time going to be mom, second time as far as I know her. So another thing is, Dr. Garima, this is all from the standpoint of medical point of view, right? Because ये सारी चीजें track होती हैं. If I say so, because हम डॉक्टर के पास जाते हैं, वो movements देखते हैं, वो ultrasound करते हैं, everything they guide you step by step, and there are a lot of classes on that. From being an emotional health educator for parents, I would say, from this standpoint, what you have to ask yourself, do I have all my systems in place? What do I mean by all my systems in place is, now the second baby will be coming in April. Okay, one thing is you have to talk about, you have to say a lot of things like the sibling, the elder one, because the situation would be you'll be having two babies. One is the elder one and one this younger one who's coming. So one is part talking and preparing your elder one for this younger one, the sibling which is coming. Another thing is talk about with your spouse, how are we going to manage each and every aspect, घर की every small thing, who's going to take what responsibility, because usually what happens कि हम इन चीजों पे बात नहीं करते हैं and we somehow wait for the last time, और जब वो बेबी आ जाता है then we think about there is nobody to help us, support us. maybe we count on नानी दादीज ओके कि कोई ना कोई उस टाइम पर आएगा, बट देन ऑल्सो हैव योर थिंग इन माइंड कि अगर वो आ रहे हैं तो कितने दिन के लिए आ रहे हैं, एंड डू आई ऑल्सो हैव अ सपोर्ट सिस्टम फ्रॉम एज अ हेल्पर स्टैंड पॉइंट, बिकॉज दैट विल बी द मोमेंट वेयर यू विल बी इन टू, लाइक आई एम द मदर ऑफ टू, सो आई कैन शेयर दैट सेकेंड टाइम जब आपका सेकेंड बेबी हो जाता है, वन इज यू आर टेकिंग केयर ऑफ दिस न्यू वन एंड ऑल्सो साइमल्टेनियसली यू हैव टू टेक केयर ऑफ द एल्डर वन, राइट, और उसके साथ में आपका घर का सिस्टम, द हेल्पर. सो बी वेरी क्लियर कि कैसे होने वाला है. ऑलवेज अरेंज योर 24/7 हेल्पर विद यू. ट्रेन बिफोर डिलीवरिंग अ बेबी. ट्रेन की कैसे कैसे क्या क्या होगा, कैसे कैसे होता है, मेरे एल्डर वाले बच्चे के लिए कब क्या करना है. सो मोर ऑफ द ट्रेनिंग इन दैट एस्पेक्ट, दैट विल हेल्प यू अ लॉट फ्रॉम द इमोशनल टर्मोइल विच वी ऑल गो थ्रू, एंड इट इज बिकॉज ऑफ द हार्मोनल चेंजेस वी गो थ्रू दैट टाइम. अपने स्पाउस से बहुत क्लियरली बात करिए. मदर इन लॉ आ रही हैं, मदर आ रहे हैं, वो कितने दिन के लिए हमारे पास आएंगे, कब वो सपोर्ट करेंगे, बिकॉज व्हाट आई हैव सीन इज, आई विल जस्ट बी वेरी कैंडिड हियर, क्या होता है, इंटायर फोकस इज ऑन द बेबी. अच्छा नया बच्चा आ गया, फिर उसके बाद बहुत सारे लोग आ रहे हैं, उसके बाद क्या हो रहा है, जब उस बेबी को मेरी बहुत ज्यादा जरूरत है, आई एम वरिड अबाउट कौन आएगा, ऑफिस का कैसे होगा. Okay, so Dr. Seema has dropped a message. She has gone to attend an emergency. She will join again if possible. We do understand, right? So coming on to this thing, so Dr. Garma, I would suggest you to reflect on each and everything. Ki how my house is going to run when this baby is going to come. My elder one के लिए, husband के लिए, जो घर के जो everything, because that will ease you a lot and focus on that younger one who's coming उस time पे, rather than worrying about this all of the other things, because उस टाइम पे इज द बेस्ट फेज टू बॉन्ड विद योर चिल्ड्रन, और उसी टाइम पे हमारी सबसे ज्यादा टेंशन होती है इन सब चीजों पे, एंड विच लीड्स टू अ लॉट ऑफ पोस्टपार्टम डिप्रेशन, स्ट्रेस, एंग्जाइटीज. कैसे होगा, कौन कर रहा है, छोटी छोटी बातें हमें पिंच करती है, नॉट बिकॉज वी आर लाइक दैट, बट बिकॉज वी आर इन दैट काइंड ऑफ हार्मोनल स्टेट इन दैट मोमेंट. But if we are prepared, it will be very easy for us to deal with all those things. And if you want to, have one-to-one, a different thing where we can talk about and more help you need, you can connect with us. There will be a number, which we have already shared also, but you are in the group, so you can consult on that. But ये एक चीज मुझे लगता है हर मदर को, प्लीज आने वाले बच्चे के लिए, वो जो आने के बाद के 3 महीने हैं, that is the time you have to pay attention more on to your mental health and that child, because उस टाइम पे हम लोग ये कंप्लेन कर रहे होते हैं, ये बहुत द बेबी इज वेरी एंशियस, ये टिकता नहीं है, इसका स्लीप साइकिल, वी नो ऑल इज दैट नॉर्मल, बट दैट टाइम व्हाट इज माय इमोशनल स्टेट बिकॉज ऑफ ऑल दीज एक्स्ट्रा burden I am carrying, extra things जो मेरे पास में होते हैं, because we don't think proactively on these aspects. So please do think proactively. Where you need help, I'm there to help you. Come and talk, ऐसा ऐसा है, क्या कर सकते हैं, I can give you a lot of options, and you can choose what you need as per your situation, क्योंकि हर के घर की situation अलग है. Some are in nuclear family, some are in joint family, some are having good support, in some houses it is not allowed to keep a helper, and lot of struggles, I tell you. But come and talk about it so that you are at ease when you are delivering a baby, and post 3 months to 6 months जब मेरे बच्चों को सबसे ज्यादा मेरी जरूरत है, I'm there for them, not carrying this extra burden all the time on my head. Who's coming, who's going, कैसे होगा, कौन करेगा, like all those. I hope this will help you. And now I think I would open, if any one has any live question, we'll be open for that. So we have Ishita. Ishita, do you have any question? Please, you can unmute yourself and ask us. Okay, if there is any, you can also post in the chat box. You can use the chat box. If there is any question, I'll open this forum. And guys, are again reiterating, every time we float a Google form in the group, abhi entire week, if you have any question, anytime you can open that form and post your questions there, so that agar aap live mein nahi bhi aa pa rahe ho, so later when you will be listening to all these videos get uploaded on the YouTube channel, and link is also shared. So agar aap live nahi bhi aa pa rahe ho, you will have the answer to your question that ways, right? So another very important thing, because it is a festive season also, और मुझसे बहुत लोग ये question पूछते हैं, I would like to tell you something before we close this session in the next 9 minutes, as we do it every, we do it on Sundays. This time we reschedule it to Monday. So एक important question जो आता है, how to help, how to connect with my child and what is really important for your child. This is for all the mothers, right? So क्योंकि connection पे क्या होता है, at times I really want, there's a one incident which I really want to share is, I asked my son, he's just 4 years old, and I asked, what is something you wish we did more together? Like in the past year, what is that one thing you wish we did more together? I expected him to say something like watching more cartoons or getting more ice creams, क्योंकि यही होता है ना, यही होता है बच्चों की. But you know what? Instead he said, I wish we went or we sit together and watched. We are having an aquarium. We sit and we watch together our fishes more often. So simple. Yet his answer touched my heart. And this is really, I want to share. It reminded me that connecting moments don't have to be big or complicated. Sometimes little things like watching, fishes in the aquarium, that matters most to our kids. So बहुत बार mothers ये question है कि हम इनके साथ connect कैसे करें, right? And it also, this particular incident also reminded me how important it is to ask. Yeah, we can't always guess what's on their mind. But when we give them the chance to share, we open the door to understanding what truly fills their hearts. है ना, हम अपने बच्चों से कई बार पूछते नहीं हैं, एंड वी डोंट, जब पूछते हैं हमें लगता है कि बहुत यही बोलेंगे, कार्टून देख लो, बैठ के ये कर लो. नहीं, आप उनसे अगर कई बार पूछेंगे तो यू विल बी सरप्राइज द काइंड ऑफ आंसर यू विल बी गेटिंग, एंड दैट विल गिव यू, बिकॉज दीज आर द वेरी पावरफुल क्वेश्चंस. दे शो योर चाइल्ड, जब आप उनसे पूछते हो कि आपने सबसे ज्यादा मेरे साथ क्या एंजॉय करा, क्या लग रहा है आपको, कि उससे क्या हो रहा है, दे, दिस इज वेरी पावरफुल बिकॉज दे शो योर चाइल्ड, जब आप ये क्वेश्चन पूछ रहे हो, दैट देयर वॉइस मैटर्स एंड लेट्स देम नो यू आर लिसनिंग. और उनको लगता है कि या मैं जो बोल रहा हूँ वो मैटर करता है, एंड माई पेरेंट्स आर लिसनिंग टू मी. When we take time to hear their thoughts and feelings, we build trust, understanding, and connection. So this is one tip I really wanted to share. How to build connection is just go and ask the powerful questions. And I would definitely in future I'll be covering 50 questions which will help you. If you need, you can get in touch with me anytime. 50 questions which you can ask your child. एक साथ नहीं पूछने हैं. You can pick one, maybe 1 week or something like that. But rather than expecting कि वो आके आपको कुछ बोलेंगे, the only thing which we have to learn as a parent is to learn how to ask the right questions which help my child to express freely, express their emotions freely. And that is for the every relationship. All those who are listening to this video who complains about कि नहीं लेकिन husband तो expressive नहीं है, नहीं लेकिन मेरा बच्चा तो बताता ही नहीं है, मैं इतना उससे पूछती हूँ लेकिन वो कुछ नहीं बताता. तो this is one thing. It's not about वो बताते नहीं है. It's about I have to learn how I ask them so that they open up. How shall I give them that environment which is judgment and criticism free? Right? How can I nurture them in such a way कि बातों में ही they are becoming so expressive and they're not knowing and they are not even thinking about कि ये चीज बोलनी चाहिए कि नहीं. So these are a couple of things which will help you to connect. No matter it is your husband, no matter it is your child, but yeah, बच्चे को आप शुरू से अगर जैसे पूछेंगे, you'll see your children will start to use this kind of skill where they will also help you to ask the right question. Because I see the type of question I am asking my child, when they see me low or some days they come and they ask that, which really help me to come out of all those moments. So it is not one way, it's two way. So better learn here, they are automatically learning. So having said that, and there is no more questions we have addressed all the questions. Hope this live help you with the PMS, the pregnancy related things. And one more we covered is how to get ready for the second delivery, and this quick hack to connect emotionally with your child by asking a very powerful question. What do you love more to do with me? Thank you so much. And we'll see you next Sunday at 11:30 to 12. The time is same, and we'll update you in case there will be any change. Thank you all. Bless you all. Wish you again a very happy festive season.